How does bone hardening affect osteomalacia in osteoporosis patients? Imagine bones as a sturdy building made of bricks and mortar. Bone hardening, or mineralization, is like adding the mortar that makes the bricks stick together tightly. When this process works well, bones are strong and resilient. But in osteomalacia, this process is disrupted. The bones don't get enough minerals like calcium and phosphate to harden properly, so they stay soft and weak. This softening causes pain, deformities, and a higher chance of fractures. Osteoporosis is different. It involves a loss of bone density, meaning the bones become thinner and more fragile. The structure is compromised because there is more bone being broken down than built up. When someone has both conditions, the problem becomes even more complicated. The bones are not only thin but also poorly mineralized and soft. This means even if treatments help increase bone density, the bones might still lack the necessary mineralization to be truly strong. Bone hardening plays a key role here. In osteomalacia, defective mineralization means bones remain soft despite the presence of bone tissue. This softening makes bones more prone to fractures, especially in areas like the hips, pelvis, and ribs. When osteoporosis is combined with osteomalacia, the risk of fractures skyrockets because the bones are both thin and poorly mineralized. This double whammy makes bones extremely fragile and increases the chances of pseudofractures, which are cracks that don't go all the way through the bone but are signs of osteomalacia. Diagnosing these conditions together can be tricky because they share symptoms like bone pain and fractures. However, osteomalacia's hallmark is soft bones from poor mineralization, which can often be fixed by correcting vitamin D levels and ensuring enough calcium and phosphate are available. Osteoporosis treatments usually focus on slowing bone loss and increasing density, but if mineralization is also poor, these treatments might not be enough. Addressing the mineralization defect is essential to restoring bone hardness and strength. Treatments aimed at improving bone hardening involve supplementing vitamin D, calcium, and phosphate. These help the bones mineralize properly, making them stronger and less painful. For osteoporosis patients with osteomalacia, this approach is vital because it enhances the effectiveness of other therapies that aim to increase bone density. When bones are properly mineralized, they are better able to withstand everyday stresses and reduce fracture risk. In essence, bone hardening is the foundation of bone strength. When it fails, as in osteomalacia, bones become soft and fragile, especially in someone who already has osteoporosis. Managing both conditions requires a careful balance of correcting mineral deficiencies and supporting bone density. Proper treatment can improve bone quality, reduce pain, and lower the chances of fractures. Always remember, if you suspect any bone health issues, consulting a healthcare professional is the best step to get personalized advice and effective care.